perfect timing.
Hello, it is the Practical Medicine Podcast. We are
Dr. Rob Bàlko
and Dr. Stephanie Lipnicki. It is the mission of our podcast is to bring awareness to the public at large about the many different ways to maintain health and heal your body, mind, and spirit, from acupuncture to Zen living and everything in between.
And tonight we are honored to have our guest, Dr. Clayton Shiu, a friend of mine, colleague, instructor, and founder of the Shiu Clinic, the first neuroscience-based acupuncture clinic in Manhattan. Dr. Shiu, welcome, and tell us about your experiences in the world of medicine, Asian medicine. How did you get started?
Hi, guys. Thank you for having me on the broadcast. It's my honor to be here. I love what you guys are doing. I got started in Chinese medicine around like the 70s. And I was exposed really on to acupuncture and Tai Chi, and pretty much got a very early head start, I would say, in America, just having like hands-on training. So I would study like Tai Chi, and then I would like basically learn Toi Na, pulse reading, how to hold the body, how to use acupuncture with patients and stuff. So eventually I got a physiology degree from Boston University and entered into Chinese medicine school, which was actually developing in America still. And at that point, as it kept evolving, I kept evolving with it. So I got like a sports medicine practice. I was treating like Mets players and different professional athletes and traveling around the country. And so I had a very successful sports medicine practice in New York City. And then eventually I actually left America, walked away from a very successful practice and went to China. What happened was I actually met one of the godfathers of acupuncture. His name is Dr. Shui, and he is featured in the documentary 9,000 Needles. And it documents the path and healing of a stroke patient and how he traveled to Tianjin, China, and was able to walk after 9,000 needles. So, and just by and luck, a lot of luck, I met Dr. Shui in Scottsdale, Arizona, and there I trained with him, and he invited me on a full scholarship to do my doctorate at the first teaching hospital in China. So that's how I got into it.
That's amazing.
And did you find that it was very different being there? Like, what were some of the adversities that you found, or did you just fit right in?
Oh, no. When you're an international student, you have to learn how to follow new rules, especially in a different country. And, China is a communist country and everything. And the whole hospital setting was different than what we have in America and how we teach. So there's many interns kind of vying for a chance to give acupuncture or give healing to a patient. So whereas in America, you'll have your chance the third or fourth year and you'll get your own patients. In China, you really have to work for it. You're competing. It's very competitive. So you really have to work hard, and then you're given a chance to needle a patient. And if you didn't needle them well, you kind of will have a second chance 2 or 3 months later because there's a long line of people that really want to prove themselves too. I mean, And an acupuncturist in China, they can study to prescribe like antibiotics. They can, prescribe X-rays, MRIs, do blood work, whereas we're a little bit more limited here. So seeing how acupuncture can really merge and integrate with Western medicine was definitely a treasure to see in China. So somehow, I think it was muted. Your mic was muted. Rob, could you say that again?
Yeah, I was wondering, so you went to China and you worked at the first teaching hospital of Tianjin, and you got more into neurological treatments versus the sports medicine you were doing. Tell us about that transition.
Yeah, so the amazing thing about seeing neurological treatments in China is, especially in the hospital I was at, is that if you have a patient with severe conditions like MS or Parkinson's or even ALS and stuff, so like because they're living in the hospital on certain wings, you can actually see what the right number of acupuncture sessions can do to help a patient. When you start a practice in America, you may see a patient once a week or once every couple of months. And the thing is, if you have like a nerve entrapment or a herniated disc, you really have to have the patient come in like 3 times a week, something like that for, maybe a month, maybe 2 months. And seeing that without the nervousness of asking a patient, okay, I think you should come in more often. Like in China, it was like, you just go every day until you can walk again, you can talk again, you can speak again. So
I think that's a huge struggle here with trying to get that message across that at the onset of care, more frequent treatments are necessary. And I think that we try and keep reiterating that there is that need in the beginning to come more frequently. I think there's this unrealistic expectation that people have here in the West of like, oh, I'm going to come once a week. And it's like, no, you need to have a better treatment plan.
Right. Exactly. And also like, because you're treating the nerve, sometimes you're treating a stroke and, damage to the brain. You're really trying to promote healthy blood flow to the brain. And that it's just different than spraining an ankle, basically, and getting done in a couple days. It's not going to happen. So when you treat stroke or neurological conditions, you're really looking at every 10, 20, 30 sessions to really evaluate, okay, did we make progress or not? Versus when you have, you just acutely sprained your ankle or threw your back out, you may be recovering very quickly because the damage is not as severe and the tissue is different that we're needling too. So it was nice to see in a true hospital setting where patients will stay for a month, 2 months, 3 months, the arc of how getting more sessions actually helps, and it actually you get dividends and huge returns back. So I would definitely say to patients listening, when you see your acupuncturist, they're really trying to help you. They're actually really about wellness. I think that's the beautiful thing about our profession. We didn't get into this trying to earn like a surgeon's salary. We got into this because we really cared, and we had our own either personal healing experience with it, or we were exposed to a great doctor of Chinese medicine or Ayurvedic medicine or whatever it could be. And that's usually why a person like us gets into, I would say, holistic wellness medicine. So,
healing.
Yeah,
so,
exactly.
In your practice, you use somewhat of an integrated approach when you're caring for patients. And to me, an integrated approach goes beyond just the needles. You might be using some of the other adjunct therapies. Do you focus your treatments primarily on acupuncture and herbs? What's the integrated approach for you in your clinic when you're seeing patients?
Yeah, so we have if you're coming to us specifically for our neurological type programs that we offer, we have what's basically, I call it like an immersion program. So if we know that you've had concussions or may have brain fog or may have like even like Alzheimer's or early dementia, like what we recommend is in the beginning, we'll do a full neurological evaluation, but then when we say integrate, we'll actually get a full QEEG brain scan, and we'll actually scan the brain and get images of your brain and where the inflammation or circulation is good or bad. And then after we do that, we explain it to you in a report, a very detailed report where the slides are as accurate as like a functional MRI. And it'll show you which parts of the brain needs stimulation or circulation. And then we'll pick a plan. And our plans are usually based on the Shinao Kaichao system, which means awaken the spirit and open the orifices. That was taught by Dr. Shi Shui Min and then adapted into what's called the nanopuncture neuroflush system, which allows us to take components of it to stimulate healthier blood flow. So after you get through 1 month of treatment, and assuming you need this kind of treatment, we'll do a reevaluation of your brain again, and we may reevaluate you in different ways as well. We may look at your blood work. We also use what's called photobiomodulation, which is very cutting edge now, but works beautifully with acupuncture, in which case we'll use, it's called red light therapy, or basically a red light low-level laser, which can help stimulate healthy circulation to the nerve and brain as well. And pulsing of the light at what's called the gamma frequency, which is basically anything that pulses 40 times per second, whether it's light or sound, can actually be helpful for dissolving deposits in the brain, whether it's from Parkinson's or conditions like Alzheimer's. So we use light in this way. So we use photobiomodulation, local lasers, and we have what's called it's actually called a region pod, which looks like almost like a tanning booth, but you can lay in it and it actually will shine around your whole body. And it's great for sports recovery, but it's amazing. It actually gives a lot of energy to our patients who have like Parkinson's, MS, stroke, and concussion, and it actually helps reset the ATP in their mitochondria. So when we say integrate, we definitely go through from the far east to the far west.
So combining both. And I love that you're getting that scan of the brain later on in the care, because I don't know necessarily that that's often done. Like when someone goes and sees their neurologist, how often are they scanning to see for changes in the brain? And it's something concrete that you can show your patients, like, here's how your brain has changed since we started the acupuncture.
Yeah, exactly. We definitely want to have objective findings that we can both, as the patient and the doctor and staff, see, and then we use that to gauge our progress and stuff. And it's kind of interesting. The more we do it and we think of meridians, we think of the nerve pathways, and we think of basically like wiring in a house. You're going to reset the circuit breakers. You're going to reset the wiring in the house, so that like maybe you need to like put two plugs better together. Maybe you need to re-insulate the wire, And so medicine is a little bit like that. You're really trying to get the most out of your body. And you really want to have longevity, but it doesn't happen by itself. It takes effort. So I practice Tai Chi, and one of the things my Tai Chi master always says is to relax and to rest takes great effort. It's not a passive thing. So yeah.
And I think that's something that we'll have to get into at another time. But between meditation and all the things that people, need to kind of teach themselves how to do and what it is and what it's not. Mm-hmm. I wanted to talk about also that you, on your website, it talks about that you do a lot of work pre and post surgery, which we really haven't gotten into yet because we haven't covered any topics that talk about that. And how important it is if you have a surgery coming up and that that's happening, not something that comes up in an emergency situation, which in that case you would need to do the acupuncture afterwards. But I like that you talk on your website about how important it is pre and post surgery when you're having surgery to get treated.
Yeah. So my office is in a very fortunate area. There's like 10 major famous hospitals that are operating within like a 20 block radius. So one of them is like Hospital for Special Surgery, and I've worked a lot with the patients that have needed like hip replacements or knee replacements or robotic arm repair, stuff like that. So what I had learned was that you can do this amazing protocol. It's very simple. Your acupuncturist can do it, where we stimulate, like if you need a hip replacement, actually put acupuncture needles into the ankle and the foot, and then a couple local points in the hip. And if we do this about like 4 weeks, even if it's just once a week before your surgery, after you get the full hip replacement, your foot and ankle will not swell up, not easily or not at all. So, and that's pretty amazing because usually it's like a waterfall where the procedure is done. So what you're doing is you're preemptively prepping the body for that surgical procedure with these, micro needles that are as thin as your hair. And just by doing that, your body will know what to do. It'll control inflammation very naturally. It'll control circulation in the lymphatic system. And you'll start to feel the patient can recover much more quickly. It's almost as if the doctors are usually shocked. They're like, okay, that's pretty unusual. You don't have inflammation, like after the procedure. So it's great. And I highly recommend it. Like if you have a procedure, any kind of surgical procedure done, definitely contact your acupuncturist and have them work on that local body part.
I recently just had a patient who had a hip replacement, and this is the first time I've had a patient with a hip replacement that they went in through the front of the thigh. And little, like no PT whatsoever afterwards was recommended. She was someone who had come to me in the past for different things. And she immediately, she was like, no, I think I need to do this to make sure. Like she had read all these different things about how after hip replacement, you could have permanent neuropathy going on and all of that stuff. And she did say, like in the first week, she felt that feeling of neuropathy, a lot of that burning.
Yeah.
We did needles and moxa, and within a couple of weeks, she was good to go.
Right. Yeah. And that's the beauty of just adding a couple points. And moxibustion is amazing because it provides a lot of energy, to the area to heal. So, yeah. And it's interesting because I'm sure like you've seen this in your practice too, but there will be like a marathon runner who's never sprained his ankle, and maybe he'll just arthroscopic surgery in his knee. And then the whole thigh looks different right after that very should be straightforward procedure. And that's because his body has just never been flustered, never been tested, never sprained his ankle once. And then age, 55 or something, he'll get that injury. And so that's where having the acupuncture done before and after will help control and maintain like healthy circulation for that patient. Yeah.
So, and you kind of talked about this already, that the treatment in China versus here is different in the sense that it's assumed that it'll be more frequent in China when you have.
Yeah. And I think also like in the case of, let's say for like stroke patients, in America, if someone gets like a stroke patient, they will basically get released from the hospital usually on the day of or within a couple days. So let me just close this because I think this is coming from my end.
Okay.
Sorry about that.
No, that's okay. We were all trying to figure out where the noise was coming from.
Yeah, I have a little my little pandemic puppy here, so she's trying to get attention. So.
Bring her on.
There you go. So and usually what happens in America, unfortunately, we get released a little too quickly from the emergency room and from the hospital. A lot of times it's because, unfortunately, with American medicine, it's kind of like when you go to the mechanic, not American, but like Western medicine. Like you go to the mechanic, if it doesn't make a sound, they're going to be like, well, there's nothing to treat, you know? And with acupuncture and like holistic medicine, we're not really looking just for that one target spot. We're looking for other changes and other patterns that tell us why this happened. Like, was it your, could it be your cholesterol, or was it the digestive system that was off? And we have our formulas for that too. In China, if you had a stroke and you went to the hospital, you're going to be in there minimum like 17 to like almost like 24 days, in which case they're observing you, they're testing you. And so you actually have a lot more attention to care, because a lot of times with these kind of events, there are symptoms 1 week later. Whenever anyone has a stroke, there's like a 2-month window where there might be a second stroke that could happen. So we definitely want to get patients past the 2-3 month window. And so a lot of times in my practice, it's almost like we're in some ways almost like a concierge kind of department, like our medicine, because we will look for and help you develop your own medical team. You may get acupuncture for us, but I always have patients who actually always ask me, do you know a great neurologist? Or now they can't speak, do you have a speech therapist? And so we have our own personal Rolodex of like speech therapists who we've used even when there was the pandemic and people couldn't leave their homes and everything, but we could still send you a speech therapist through Zoom that you can practice with.
Right.
So I find that as a specialty, we've developed many different connections where we've learned the vernacular of how to talk and communicate to other professionals, whether it's a physical therapist and you're talking about nerve glides, or whether you're talking to a speech therapist and you're talking about AOS or speech aphasia. We've learned to educate ourselves, and I find that many acupuncturists, my colleagues, like both of you and others who I've trained, like we've learned the vocabulary and the medical terminology of other professionals so that we can share with them what we find. So yeah.
I think that's something that not everybody realizes, that we have to learn Western terminology, but no one, on the opposite end, they're not necessarily learning the vernacular that we use.
Right.
But in order to get, to be able to communicate that, we have to go that extra mile and learn all of those other things that go with whatever your specialty is. Like in my case, it's gynecology, knowing all the terminology, because someone who comes in isn't going to say, I have blood stagnation in my abdomen. They're going to say, my doctor diagnosed me with this, and you have to know how to then put it into that terminology so that you're speaking that language.
Exactly. And that's so important, because we can do so much for a postpartum patient or for a patient who has like prostatitis, There's just so much we can do. There's so much history and knowledge that helps them, right? So, and of course, sometimes you go to your acupuncturist for that Hail Mary pass of, like the famous point, like there's a breech baby, right? Like, of course, our go-to thing is always to massage and needle and do moxibustion on the pinky toe, right?
Right.
And it's amazing because there are hospitals that use it now, but because it's so effective, it's not the Hail Mary pass. It's more like, you better do this before your third trimester, because otherwise that baby is a little too big to spin around now, So.
And I think focusing that on more on like the labor prep part of it is something that's important, and not waiting until, my doctor is going to induce me tomorrow. Is there anything that you can do? And seeing our medicine more as preventative. And being able to
and that's the thing is, right, exactly. We're so hands-on, and actually Western medicine can be very hands-on. There are belly techniques that a Western doctor used to do more proficiently, where they use their hands and they will manipulate the baby through the belly of the mother too.
Right.
It's just not practiced so much. It's everything's been very like departmentalized, which is great, because when it works, it's like from A to Z, it gets the job done. But like at the same time, it can be slow, and sometimes, you're in the wrong department and you got to switch back to another department. So there's pros and cons, right, to both. So,
but I find that within our medicine, even though a lot of us specialize in certain things, that the underlying is that we're still treating the whole person, where other specialties in Western medicine, they may specialize, like someone is a wrist surgeon, you go in and you have surgery on your wrist and you come out and that's it. Whereas then that person comes to us, sure, I'm going to needle the wrist, but I might needle the corresponding ankle. I'm going to needle the whole body because the stress of the surgery, and I want you to heal from it. Those kind of things that when we say specialties, we're still treating the whole person that's in front of us and the pattern that is in front of us.
Right. Exactly. Yeah. Yeah. The pattern is very important, right, in Chinese medicine, because it's kind of like the before. It's like a script where there's a before, a middle, and an after, kind of thing. And a lot of things in our life follows a pattern. You don't have a chronic issue unless you followed a pattern. It's like you did something very efficiently and correctly for a very long time. And it's our job to efficiently untie that pattern, basically.
Right. And that's the other misconception, because I always say that, everyone says that you're my last resort. You were the last one I came to. And I say this on the podcast, I say this in my own practice when patients come in. If I could make you better in one visit, I would charge $1,000 for that one visit. I would see 20 people a week, and I would take the rest of the month off.
Yeah, exactly.
And it does take time.
We usually should be the first. We should technically be the first group to see the patient.
More about prevention. I'd like to get people to see us as preventative medicine before you get sick, because something is always under the surface. I feel like stress comes in. It disrupts the harmony, and we can help move that stress out.
Well, we can see it first.
Yeah.
Where it's not on the radar all the time.
Right.
Like you said earlier, if you can't measure it, it's not there. So they send you home early.
Right.
Yeah.
Absolutely.
Exactly.
Rob, check, were there any questions that we have from anyone?
Let's take a look.
Rob's peeking on his computer.
Let's see any. No questions. If there's any questions, folks, please feel free to type them in and we'll get to them. Clayton, I wanted to go back to brain injuries and ask you, we're seeing more traumatic brain injuries in the younger population. Is there anything that parents can do to help mitigate that and prevent that?
Yeah, I think in the old days, whenever we got our brain, more like a concussion or bumped during a soccer game or a football game or something, we often, because we're trying to win the game, we brush it off and we get up and we go and we get back into the game, And I think a lot of post practice is really important. I do think it's important to have trainers that are actually biomechanically observant, that can read their child or their athlete, but also ones that also, believe it or not, it applies to them. We need the vernacular to talk to a good acupuncturist or a physical therapist, in which case they can cue us to help them too. So I think it is good for young people, especially teenagers, to actually be exposed to acupuncture at an early start. And let me explain why. I got into this at age like 10 to change life. So, I didn't really have consistently taken aspirin until I was like in my, late 20s, early 30s. And that was probably because of paperwork or something, like not the injury, So like when you're exposed this early to something like Chinese medicine or other forms of medicine, it changes your whole perspective on empowerment, on healthcare. And because of the way we talk and work with our patients, that teenager will actually know that they have a choice and that they can ask help, that they'll admit that they are seeing spots in their vision or dizziness, because we fight. Our body's always in a state of flux. We're always fighting for balance, Yet somehow after the 2 million or 100 million chemical reactions, maybe not at 5 or 8 years old, but definitely like, from age 14 and up, like get them to know their acupuncturist or their chiropractor or what have you, and change their perspective on healthcare from the start.
So I'm going to actually disagree with that. I think
okay.
4 years old, like my kids were exposed because I was in acupuncture school when I got pregnant,
Right.
and it's a normal part of their life now. Like they think, they're like, oh, I feel like I'm having a cold. Let me go take a Gan Mao Ling. So I'm good with them being exposed as young as 4 years old and having, like I've volunteered with friends who are teachers to go in and talk to the kids in the schools so that they know who we are and don't think of us as like this scary place,
Yeah. Oh yeah. I was speaking in relation to concussions and athletes, but definitely, just like there's like Yin Chow Jr. and like there's some amazing like children's formulas and for sure there's amazing like pediatric techniques where we do neji up the spine and we massage through there and all that. So let me rescind that and widen my answer a little bit.
I'm just in Jersey. So. I bust chops, so I know.
Sorry. My future children will be at your office. So
Good.
I once heard a colleague say that by the age of 5, most children have had a concussion from playing and falling. This is Ayla Wolf, by the way, who mentioned.
Okay.
So I think it's great that there's what you're advocating is more awareness on the training part, the professional side, and early intervention, right? Is to bring these kids in as soon as it happens. I noticed I was watching a football game, and they said that some player he didn't maybe have a concussion, but he had sustained enough injury that they were preempting it and taking him out of the game, which is a huge difference from 10 years ago. Where they were. So
I watched something, and I'm not a sports person. Let me just say I'm not a sports person. And I watched it only because my cousin's son is at Princeton University and he's a football player. And it was basically on like and I would have never known this otherwise, that there's a lifetime for the helmets. All these different things. And, in talking to you guys that you both specialize in neurology, I feel that colleges and football teams should have acupuncturists as part of their, medical staff to be dealing with this from that and help the healing and, return the brain function back to normal faster.
Yep.
So
there's
that.
Yeah, definitely, because the acupuncture has a direct effect on neuroplasticity. That's like it's another big concept that has changed the landscape of medicine.
Knowing that the brain can be malleable.
Right, and that can heal, and that nerves can actually heal, because basically it was Christopher Reeves who had unfortunately suffered a major injury from horseback riding, but he was so determined to know and to know the research, the real research that can be done to see whether or not nerves can heal. And the bottom line is it can, and that really opened the door and pushed all these other new frontiers into like how we look at the brain and how we look at nerves and how nerves are plastic. They can be remolded, they can be reshaped and stuff. Yeah. So it's a major thing. I think you'll see a lot more of acupuncturists in the different sports teams at many levels now. So, yeah.
Yeah, a week doesn't go by in my office where someone doesn't come in and say, well, I have nerve damage. And I say, well, let's talk about that. And they say, what? Really? You can work on that? They think
and they're in for something completely different.
Yeah. We start from the head to the toe. We find out that they have difficulty walking, or they're unclear about steps, or their feet just hurt all the time. And it's just something that they've come to be totally acclimated to.
Right.
Yeah.
You have to live with this and tolerate it, and they don't. Right.
Yeah. There's still, I mean, there's a lot of Western medical doctors, they're still wrapping their head around this can just treat lower back pain, and
right.
Here we are talking about like, speech paralysis and this and that, and that's like on another like, frontier there in their minds.
So I wanted to make sure that we also talk about that you have a new project that you've been working on during the pandemic with working with herbs, specifically with astragalus, to help with some of the post-COVID things that are going on. Christian, can you I just want people to see so that they can look for, just so they have an image of this, and we'll share a picture of it on the feed after. So talk to us a little bit about Shiu Botanicals and what's going on and the progress that you've made and things that you've seen post-COVID.
Sure. So when the country was shut down basically, and New York City was like the epicenter, thank you, Christian. I actually got COVID myself, and I had lost my sense of taste and smell and was having some breathing issues and and stuff. So it got me into this, like I felt like I was wearing a glove around my head and my body, and it really made me research, okay, how can we help like breathing and restore taste? Because when you think about it, like the cranial nerve, the first cranial nerve that controls olfactory, which is like your sense of smell, it's a major sense organ, because your tongue only senses like bitter, sour, sweet, and like spicy, So what happened was I have this friend, and she happens to own an Indonesian skin.
Did we lose Clayton?
Her name is, and so she was sharing with me.
Clayton, could you go back a step or two?
Can you hear me? Yeah.
Yeah.
We can hear you now. We lost you right as you started talking about your Indonesian friend.
Yeah. So I have this Indonesian friend and colleague, and she has this amazing Indonesian skincare company, and they use Indonesian herbs, and it's called Juara. And her name is Meta Madura. And so during the pandemic, we started talking and sharing more and more about the Indonesian herbal approach and also the Chinese medicine herbal approach. And these conversations kept progressing, where we were already thinking that, okay, as the pandemic was spreading, that it would respread again, almost like a second wave and stuff. So, and I had thought about how like, well, we really want to affect breathing and like treat those kind of symptoms and try to restore breathing, respiration, oxygen. And one of the herbs that I talked about was astragalus. Now the thing is with Juara and Meta's company is they embrace what's called jamu, and jamu is the Indonesian herbal principles that that they use in their culture. It's very like it's a part of their life when you go to Indonesia. So the three principles are the enjoyment of self-care, like they enjoy taking care of themselves. They enjoy the pleasure of the senses. And they also have what's called a warang, which means wooden table, but implies community, that you have community among people, you know. Right. And so with those three kind of pillars, as she and I were talking, we realized like, you know, like we want to help people better with self-care, but we wanted to fuse Indonesian herbs with Chinese medicine herbs. And so we had begun a project starting almost like 8 months ago, and it just started through conversations and that whole community part. We're doing it in the world today. We're using Zoom, so it's almost like Zoom is this warung wooden table that allows us to feel connected to the world again. And so as this started happening, we were trying to see, well, which herbs can we use? And so I brought another friend in named Chris Langer, and he has this amazing other herbal company that helps make really highly refined serums. So we made this super refined herbal serum of astragalus that's very, very potent. And what we did was we married it to the base creams of Jwara skincare products. And why did I want to do that is that, you know, every couple of decades, I always feel I've been in this profession for a long time, and I can see that it keeps elevating, you know. Just the way we're talking about professionals wanting to use acupuncture more, to me, that means the profession's elevating. We're not hiding, you know, and also that even once in a while, insurance may cover acupuncture. That's like a huge step. It's like a huge life-changing step in the world, you know. So us fuse Indonesian herbs and turmeric and also with astragalus, we made this cream that became, it just covered this full spectrum of stuff and of symptoms, you know, where we would use it, where we would actually put it on our wrists and put it around the throat, and you can actually feel like you're breathing better. Actually test it with a pulse oximeter to see that the oxygen level in our blood was actually changing. And then I would also put it on my neck, because I had neck pain and wrist pain. And because astragalus is so amazing, it leaches out dampness and cold, which causes pain in your tendons and in your bones. And so it actually had that effect as well. So this full spectrum Huang Chi Cream became really a beautiful fusion of TCM with Indonesian herbs, and having the sophistication of the Jwara company was such a treat, because I love HIT medicines and I love poultices, you know, but I don't want to put a poultice on and put this white jacket on, then you'll see a brown stain behind my shoulder. My shoulder may feel better, but like my friends think I rolled in like, you know, dog poop or something. So, you know, or sometimes when I put a great liniment and I put it on and my friends think I'm like putting soy sauce on my body, you know. So the beauty of the Jwara creams and the base creams is that we made it so it infuses with the TCM herbs. It actually keeps it moist. It's very smooth, right? And you just feel like you actually feel like you bought a cream at like Sephora or some like botanical place, but it's got a very high level, very refined, concentrated level of Huang Chi, astragalus, and other Chinese and Indonesian herbs in it. So yeah.
Very cool.
What color is it?
It's actually like off green and white. So for now, I can show you how we do it if you want. So yeah,
very cool.
I'm looking forward to trying it out.
Yeah, I'm anxious.
Yeah, it'll be ready. It'll be ready in April, but we'll have a little sign in the podcast. So if you want to email us and
we also
our email pre-order list. So.
We linked your info. We have a link tree that has listings of our guests, so that people can navigate to your website and follow you as well, and get info.
Okay, great. Yeah.
So, do we have any?
We have a question.
We do.
Yeah, from Hillary. Recently, I've been reading research that observed in the West, we've spent too much time focusing on GI health, gut health, to fix many health issues while unfortunately not achieving optimal results. Instead, it would be beneficial to focus on brain health first: meditation, cold therapies, breathing techniques, Reiki, etc. Would you agree or disagree?
I think that they're both intertwined. So that's why they're two ends of the same ruler. So it's true. You have to actually focus on both so that they can meet in the middle. A lot of what we do with the neuroflush and the nanopuncture method is to directly stimulate healthy blood flow, right? And I find that connection, in which case, in some ways, I do agree with Hillary that, yes, a person walks better after having their brain stimulated, even if they're walking difficultly or they're not moving their arm or speaking better. But the digestive system is the engine of the body. It's where the fuel comes from, so it's still connected. So the best thing to do is like a comprehensive approach where, let's say, X percentage is concentrated on the brain, another X percentage is concentrated on the digestive system. And then finally, another percentage of it is the patient doing the work. They actually have to like strengthen their shen and get that like zest for life back. That can actually, derail everything, right? Whether you're trying to lose weight or walk or what have you. Yeah. So.
Yeah. If you remember the end of 9,000 Needles, the subject, I forget his name right now. He's frustrated and angry, and his physical therapist helper is, you got to get your head right. You've got to focus on getting better. You can't just rely on the physical.
Right.
Yeah. So it really maps very well with that.
Yeah.
Yeah. Did you have some thoughts on that question?
I think both are important.
Yeah.
But I think that for Eastern practitioners, we're viewing digestion very differently than like strong. To me, it's always, if your digestion is strong, then it's making the chi and blood to then fix other things. Like for me, it's not just the needles. If you come into my office and you eat McDonald's and garbage all the time, you're not giving me very good chi and blood to move around to heal the other things. And then you've wrecked your digestion. So now I have to strengthen your digestion so that when you put good food in, that you can make use of that good food. So I think it's both the brain and, but there's a very strong gut brain connection that we can't even begin to get into right now. We could do a whole nother podcast on that, the brain gut connection and how important that is.
Definitely. Yeah.
I think that's important. Any other questions that we have?
No,
anything else that you wanted to share, Clayton? No.
I can show you just let me take this jacket off. I'll show you just how unique this this full spectrum Huang Chi Cream is. So what's really different about it, and a lot of it's because of how potent our Huang Chi serum is, which we've been perfecting, is that unlike many creams or even herbs, you do not swallow the Huang Chi.
In this instance.
Right. You actually you'll just take it.
There,
take a
better.
Little bit, you put it on your wrist like this. Okay. And you literally just do this. Okay. And you actually will massage it through and up the lung and heart channel like this. Okay. And you take it and you'll massage it up and down like that. Yeah.
For people who are just listening, it's on the inside of the
exactly.
Arm.
Yeah. And then after about like 30 minutes, we've actually given it to asthma patients. Okay. And they actually started breathing better. So it's pretty amazing. So you could put a little bit like around the throat or on the chest, but this is the beauty of this. We're actually making sure we massage it into the lung and heart meridians.
Right.
And this is what's like highly unusual about it. Yeah.
Yeah.
Very cool.
Yeah.
So you're not only applying it, you're stimulating the channel at the same time.
Right. Yeah. And that's an important thing that had developed from our conversations when we were developing this, was that people want a daily ritual to get through these difficult times.
Right.
You want to make sure that you follow your ritual, whether you're getting on the Peloton bike, then eating a protein shake, whatever it is.
Right.
You want to stick through it. And you also want to stay connected to your doctors, your herbalists, your neurologists, etc. Like, do not let any of this lapse and make you not sharp enough to know what you have to do. So you want to definitely, it's a big part of health is to stick to these rituals. And that's a big part of what you'll be probably hearing from me and Jwara and the Shiu Botanicals, is we'll be designing products that will help your daily rituals keep your respiration stronger, keep your immune system stronger too. Yeah.
Wonderful.
So.
Excellent. Well, I want to thank you so much for joining us and sharing all your info with us. I have a little bit of housekeeping to do. So I just want to remind our listeners that the Practical Medicine Podcast is now available on Spotify, Pandora, SoundCloud, Apple Podcasts, and YouTube, as well as being able to watch the replays right here on Facebook. Make sure you're following us on Instagram, that you have liked and followed us on Facebook. You can find information about our practices, Dr. Rob and I, on our Linktree page. Dr. Rob's practice is the Atlantic Center, and it is located in Neptune, New Jersey. Mine is Natural Alternative Center for Wellness, and it is in Allentown, NJ, not PA.
Don't go there.
Yeah, don't go to PA. Just a reminder that we have switched to a weekly recording. And if we have some lengthy topics, that we might extend them into 2 episodes. And our next episode next week will be in honor of February being National Heart Health Month. And we're going to talk about heart health from a TCM perspective, some Western things that you need to be aware of. And then for the last week of February, we will be welcoming Dr. Daryl Thuroff, who is not just a licensed acupuncturist like me. She also wears the same hat of being a massage therapist. And I think that's all the housekeeping.
There is one more comment from Daryl.
Sorry.
Maybe she missed the part about the pulse ox. And the question was, are there any other ways of measuring the efficacy of the lotion, and like the pulse ox, perhaps?
Yes, you can. I would recommend a blood pressure cuff, pulse ox, and also just for pain relief. Actually, we still use like the 1 to 10, international standard. Yeah. So, but this is the first cream that anyone has ever said that you can use these devices to actually see if this cream is effective. So I can't wait to. Yeah.
I guess another thing you
can do
is count the number of breaths per minute.
That's true too. Counting the number of breaths.
Of course, without letting them know.
So, excellent.
Yeah,
thank you again.
Sure.
Thank you, Christian, for being our tech support. We'll see everyone next week.
Yes.
Thanks. The contents presented during the Practical Medicine Podcast include information about various modalities that exist to achieve health and wellness and are for informational purposes only. You acknowledge and agree that the following disclaimers and warnings shall apply to all content presented.
The podcast contains the opinions of Dr. Robert Bàlko, DAC, LAC, and Dr. Stephanie Lipnicki, DACM, LAC, and the guests of their show. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you have regarding any medical condition.
The views expressed in the Practical Medicine podcast are our own and do not represent those of all licensed acupuncture professionals. Always seek the help of your own acupuncturist or medical provider to determine your best course of action. You may want to use the information presented as a supplement to better understand your diagnosis or treatment, but it should not be the sole thing that you use to make important medical decisions. Do not use the content of the podcast in lieu of medical advice.
Never disregard professional medical advice or delay seeking care because of something you have heard on this podcast. Privacy is important to us, thus all people, places, and scenarios have been changed where applicable to protect privacy and maintain confidentiality.